Hi, I'm Dr. Shah. I'm a practicing gynecologist for the last 30 years, in fact 35 years. And today I'm going to be talking to you about something which is so common in pregnancy that this particular word is almost a synonym with pregnancy itself, and that is vomiting. Vomiting per se is such a common phenomenon that about 50 to 90% of all pregnant women do complain of it. Depending from area to area, age group to age group, the number varies, but it is so very common. Now, why does a pregnant woman feel so nauseous and feels so much like vomiting? It's actually, as I tell my patients, it is like a pregnancy package. You tend to feel nauseous, you tend to feel tired, you tend to feel lethargic, you tend to feel very sleepy, you tend to be very emotionally labile in your first few months of pregnancy. And this is all together, which kind of confirms to you in many ways that you are pregnant. In fact, in the olden times, the very fact that a woman would vomit would make people ask her, are you pregnant? So it's that common. Now, why does it occur particularly? Nobody seriously knows why, but there's hormonal, it can be biochemical reason, and can be psychological reason. And therefore, that comes extremely naturally to them. How best can you control this vomiting? The first thing to understand is that when you understand completely that this is a normal phenomenon, that this is going to happen to every woman, and in fact, it's a kind of an indicator to you yourself that your pregnancy is good. When you start equating it with a good pregnancy, you're not going to feel so bad about the nausea. The second thing is how well you divide your diet. There are certain things which are a big no-no. The first thing is don't have too much liquids in the morning. If you are the kind who's having morning nausea, morning sickness as they call it, try to avoid a lot of fluid in the morning. Try having dry things like dry crackers. You can have khakras, you can have Morocco biscuits, you can have those khari biscuits. Anything like that would probably make you feel so much better. Divide your food. Don't eat too much at one time. Eat small quantums and eat tasty quantums. There's nothing against taste as far as pregnancy is concerned. The only thing that you have to remember is you're not supposed to have things which could probably have Ajinomoto in, that means all Chinese, specifically cooked from outside is out. Any outside food, particularly your pani puris and your golgappas are out. You're supposed, whatever you want to have, you can have it at home. Years and years and years and centuries back, our Indian system has found so many things which are some superbly antiemetic in our natural, normal food of every day. The first is interestingly ginger, adrak. If you have ginger juliennes with some lime added to it and take small pieces and keep on sucking on them, you'll find that you feel less nauseous. This is something which now they are incorporating into medications worldwide. We never got a patent on it, but we were the first ones to actually say so. The second is pudina, mint. Mint per se has an antiemetic property, but the caveat to that is it should be fresh. That means if you're having a mint chutney, make it fresh. If you're having a mint water, make it fresh. You should have it within 10 to 15 minutes of making it because the aromatic oils are so great that they're going to make you feel less nauseous. So your basic pani puri ka pani is an excellent antiemetic. In the north, they make carrot kanji. Any one of you can go on the YouTube and get the recipe for that. And that itself is an excellent bio improver of your gut, which makes you feel less nauseous, and it also is a good digestive. Third, a powder made out of simple things like jeera, ajwain, rock salt, and hing. Jeera basically, again, has excellent aromatic oils. Ajwain is a digestive, and kala namak and hing that you use along with it is a basic digestive itself. So if you make a combo of this, this is a good antiemetic. Fresh curds, the use of curry leaves, curry patta in your food, whenever you temper. So right from south to Maharashtra, everywhere they use a lot of curry leaves in their food. And if you use that as tempering, you'll realize that you don't feel so nauseous. Fresh curds, green cardamom, hari ilaichi. If you keep on chewing on that, you're going to feel less nauseous. So these are the basic carminative foods which we have in our diet and in our culinary repertoire that you can use and feel better. If these things don't work, for any reason, you should start thinking, are you having a very spicy food? If you're having a lot of masalas and sour things in your food, you realize you feel extremely nauseous because you're not able to digest that food. Remember, in pregnancy, your intestines are not going to work the same way as they were working earlier. Now it's going to be a slower peristaltic. Peristaltic means the movement of the intestine slows down. As the movement of the intestine slows down, your food tends to take a longer time to go down. So if you take food which is easily digestible, you're going to feel better. So the easily digestible foods, particularly if you look at your proteins for the vegetarians, it is moong. Moong dal in any form is easily digestible, whether it's yellow, whether it's chilka, or whether it's a sabut, whichever one it is, it's going to be easily digestible. For the non-vegetarians, try to avoid red meat. Take more of chicken and fish. Egg first, fish second, chicken third, mutton last. So try to go slow on that. Cook your food well and have veggies which are light on your stomach again. And the veggies which are light, according to Ayurvedas, are the ones which hang. So anything which hangs from the trees or from the plants is what is always very much more easier to digest. So try to go for that. The next is what grows on the ground, and the least is the one which is under the ground. So you can make your choice. Take those foods. Eat small, nutritious meals. Eat them early. Do not go to bed immediately after having had your food. Take some time in between your meal and your sleep, because remember, the food itself is going to keep on taking a longer time to get digested, and also if you lie down, it's just going to feel as if everything is actually coming up and you're going to get what is known as heartburn. So if you follow these simple tips that I've given you, you'll be fine. But if in spite of that you still find that you're not able to take it, please consult your doctor. We have a number of medicines which are very safe in pregnancy, which can be taken. Your doctor will prescribe it to you, so you'll be fine with that. But remember, 2 take-home tips. Number 1, accept it as a part of your pregnancy package deal. Second, try all the natural combinatives that you have in your food basket. And last, definitely consult your doctor and get the right medication. If you like the video, please subscribe to our YouTube channel, Joyful Pregnancy, and you can do that by clicking on the button below. Thank you.